Nurse! Nurse! Nurse!
Okay, I'm here. Here's your discharge papers. This explains everything, what to do and your medications.
Listen, my back is, my pain is coming back. Whatever you gave me is going away.
I understand.
And I really need something more because this isn't working anymore.
I understand. There's medication here that you can go and get. Go to the pharmacy. There's prescriptions. You'll go and you'll get your pain meds. I have to take this off so you can go home.
Wait, but this was working good. Can I have?
No.
Can you put more?
No, you cannot go home with this. This needs to come off.
Can I have a different one then?
No, that's why you're gonna have PO medication.
What's PO?
Orally.
So.
Okay, so I need to.
But that doesn't work as good as this. My back really hurts.
You're going to be getting Norco. It's a pretty strong pain medication. Now, I really have to take this off.
How strong?
It's pretty strong. How bad is your pain right now?
It's like really bad.
Okay, well, we'll give you some Norco before you leave, but I need to take this off.
Can I have more, though? Can you?
It's off, sir.
Welcome to Chamberlain ED.
Why?
I'm just doing my job.
No, you're not. You're not.
This is what we deal with.
You know what? Okay, fine. Nurses have many roles. One of them is being an advocate for the patient. Being an advocate means speaking up for the patient, doing what's right for them and what's in their best interest. We also need to be compassionate as nurses, so we care for them not only physically, but emotionally, spiritually, and mentally. This particular morning was not going so great.
So I've been doing this for about a good 5 years right now. I just finished up my residency. It's the start of the day. I haven't gotten anything yet, but we'll continue to see what happens. You never know with a day like today. It could go from slow, it could go from fast, it could go from a lot of hard-hitting things to not a lot of hard-hitting things. So hopefully nothing too crazy occurs. But like I said, in the ED, you get a lot of random things. So I don't know. It's definitely could be a big day or not. So we got our first patient right now. Tends to be someone who wants to discuss medications. So this should be awesome. Let's continue to go from there.
Are you okay? Do you need any help?
Yeah, it's fine. I'm just trying to discharge O2, but it's okay. The doctor's in there.
My role as a nurse manager is to be the visionary, to intervene with problems, and to provide solutions to my staff. So when Melissa was having a difficult patient, I wanted to make sure that she knew that I was going to be there whenever she needed help. This is Chamberlain ED.
This is Superior 1 reporting to Chamberlain ED.
Go ahead.
We have a 17-year-old female. Her name is Lily. She was found on the floor at home unresponsive. Next to her were some syringes and needles, possible heroin overdose. Amount received unknown. No medical history per mother. She has a small contusion on right side of the head. On scene, BP was 90/63. Pulse 104. Respiration 8 and shallow. Pupils were constricted and non-reactive. GPS was 7. Skin cool. Cyanotic. Glucose level of 55. We established an IV on her right AC 20 gauge. We have a 500 ml bolus going in. She also received some dextrose. We also gave a total of 0.2 milligrams of Narcan just now. Any orders or interventions needed at this time?
You said 0.2 milligrams of Narcan?
Correct, 0.2 milligrams of Narcan.
Any allergies?
Nope, no allergies.
Continue to monitor. What is your ETA?
Less than 5 minutes.
Okay, thanks.
Thank you. Superior 1 out.
Hey Veronica, can you go get that room ready for the patient?
Sure.
Melissa, can you follow me? We're going to get the supplies that you told the doctor.
Sure.
I totally understand where Melissa's coming from. I mean, she's going through a lot in her life right now. Her dad's in the hospital, and she's been working a lot of doubles here. We're always short-staffed. So that can cause a lot of stress at work, and it just only adds up to, you know, all her feelings and her stress. So I feel for her, you know. As a PCT, my job is to take vital signs, put on the leads for EKG, do compressions if I'm lucky, collect specimens, assist in transfers, set up the room, clean the room. Basically, I'm the glue that holds this team together. And here they come.
Okay. We have a 17-year-old female found on floor at home. Possible heroin overdose. ANO ×1, GCS 7. She has a.
2, 3.
She has a right. She has a right contusion on the right side of her face. She might have fallen. On scene, hypertensive, like 90s over 60s. Tacky, respirations 8. No medical history. No allergies. Mother's on her way. Guys, anything else?
No, thank you.
All right.
I'm gonna start the IV.
All right. So what do we have here?
17-year-old girl overdosed on heroin, fell at home, contusion on her head.
You know if she was taking any other drugs at all?
I don't know.
They gave her 0.2 milligrams of heart.
What's her name?
Lily.
Lily, can you tell me where you're at? Tell me where you're at. Alright, let's start 500 bag bolus. Let's do Narcan, 0.4 milligrams. Let's do a CBC, a CMP, tox screen of both urine and blood. Let's call respiratory, have him on standby, and let's call CT. Since it looks like she's got a contusion right there, but her people see them just a little tiny bit, that's all.
Alright, I'm pushing 0.4 milligrams of Narcan.
Well, so you're not wearing any gloves.
Well, I'm almost done, sorry.
Respirations are rising.
Heroin itself is a morphine derivative that really brings down someone's respiratory drive. And in our patient that came in, she showed significant signs and symptoms of someone who would overdose, specifically relating to their blood pressure going down, their heart rate going up, and their level of consciousness just not being there. She was not able really moving. She was not responding to me. Her pupils were constricted. So a lot of the things that really lead me to suspect that someone's overdosed big time, and make me lead to also implement what I want to do in regards to medication-wise I want to give her, which was Narcan. This medication itself is going to counteract the heroin overdose and specifically bring up her respirations, which is what we want. The other labs that I was looking towards to find out if there was any other abnormalities related towards a CBC, a BMP, and a tox screen, specifically the tox screen, just to find out if there was any other drugs in her system that I could treat. Lastly, it was the contusion that I saw in her head that led me to believe there might be a brain bleed, so the CT scan was definitely in order. Lily? Lily? Can you tell me where you're at right now? No? Can you squeeze my hands for me? There you go. Squeeze them hard. Good. Check this nose again.
Lungs are clear.
Blood pressure's rising. 105 over 90. Continue to monitor.
Lily, my daughter, is she okay? What's going on with her?
She's fine, ma'am. We're just trying to take care of her right now.
What happened to her? What are you gonna do?
Well, she overdosed on heroin, so we're giving her some medication so she can feel better.
What type of medication? What does it do?
Narcan, it helps her breathe.
What's wrong with her breathing? Why?
Well, she took heroin. It's a drug. So, obviously she can't breathe.
Is there somebody else I can talk to here?
Melissa, can I talk with you outside, please?
Ma'am, I'm the doctor covering Lily's case.
Yes.
Can you tell me your name?
Marie?
Marie, what's your relationship?
She's my daughter.
So she came in with an overdose of heroin, and what that does is it brings down her respiratory drive. She cannot breathe, so when they came in, they were breathing for her. However, we gave her Narcan. We have a bag of fluids running through her. That Narcan is actually helping her breathe right now.
Okay.
It's
How long does it take to work?
she should be coming around within the next half an hour, and it counteracted the drug.
Okay. And does she need anything else? Any other tests or surgeries? Or...
We're going to give her a CT scan for the contusion that she has on the side of her head. However, and we did some blood work already. Other than that, we just got to wait and continue to monitor.
Yeah, she was on the ground when I found her, so I don't know exactly what happened. I had just gotten home.
Do you know if she's allergic to anything?
No, not that I know of. No.
And then can you tell me a little bit about her? Is there anything different? Has there been any changes at home?
She's been very quiet lately. She doesn't really talk to me as much. I'm at home a lot. I work, so I'm a single mother. She's been sleeping a lot during the day. I've been getting calls from school. She's not doing her homework. She's ditching school. She's just hanging with the wrong crowd this time. I don't know what else to do. She doesn't really say anything to me. She keeps it to herself.
All right, so we'll continue to monitor. She's probably going to be staying overnight. Just want you to be aware of that. And as soon as we get back the CT scan and some more work, we'll come back and I'll discuss more with you. Okay?
How long will she be here then?
Like I said, we'll definitely have to keep her overnight.
Okay. All right.
All right, I'll
Thank
be
you.
back.
Baby, you're gonna get all better, okay? We're gonna keep a watch over you, and we're gonna go home. All right?
Earlier that day when I had a discussion with Melissa, I thought that she was okay. However, when she became really rude with the staff, the patient, and the mother, I became really frustrated. She even forgot to wear gloves. However, I remained calm and offered her my support.
So our patient seems to be stabilizing really well with the Narcan that was given to her. Her vital signs are coming around, and hopefully later on, give it a couple of minutes, we should be able to go back in there and do a little bit of a thorough assessment, at least the nurse and I, and we can just continue to monitor.
After our patient regained consciousness, the nurse and I went into the room and were able to do a thorough psychosocial assessment to confirm that she was depressed and had a lot going on in her life. At that point, we were able to get a consult for health services, behavioral health services at that, as well as a social worker to kind of go over what can be done outside of the hospital. And I had her ordered to stay overnight just to make sure that she was stabilized, her respirations were good, and making sure that the drug hadn't taken any other tolls on her, and just to really provide some rest that was well needed. At that point, we were able to give discharge instructions as well relating towards IV drug use, instructing her that if this were to continue, hepatitis B, hepatitis C, or HIV could be results due to the IV drug use. Lastly, we gave her some support relating towards clinics and support groups that she can be a part of to help her manage the IV drug use, if not depression as well.
When Lily's mom walked into the room, I was very frustrated at first. Not only because of everything that was going on in my life, but just because my thinking was, we're trying to take care of this patient, get out of the way, we'll talk to you later. Especially because of why the patient was there, I was just frustrated all around. But then after I talked to my manager, I realized the mom had every right to feel that way and to behave that way, and I was the one who was in the wrong. So I ended up apologizing, and we did make up. So I'm going to go and apologize to Lily's mom right now. There she is. I hope she accepts my apology. I had no right to treat her or her daughter the way that I did, so...
So yeah, I was really worried about my daughter. I really care about her, and I know she's been going through a lot. I'm not home very much. She was having a lot of trouble getting into things that she shouldn't have been, hanging with people she shouldn't have. She was being very distant, not talking to me, and she got the care she needed, and I'm going to be there for her. We're going to do what we need to do, and that's all there is to it, helping her out. And everything was good except that nurse, for a little bit, made it very difficult. She wasn't really helping out much. But after a while, I think somebody talked to her and she turned herself around, and it was very helpful. So I'm very happy about the outcomes.
So I was in the ICU for about 2 weeks, and it almost felt like a month. I'm doing a lot better now. I've been going to weekly support groups, and it's been working for me a little bit. I've been going back to school, and my grades started improving. It's still a struggle for me, though. I realized all the bad stuff, that the infection and everything that can happen with the IV drug use. All the nurses and doctors over here supported me so good, and it's just helped me improve. I really appreciate all the help that they give me. If it wasn't for them, I don't think I'll be here right now.
There's many challenges that can get in the way for a nurse, such as the difficult patient that I had that first day. My own feelings and biases also got in the way. I didn't give her the proper care that she deserved because I didn't like the fact that she overdosed on heroin. Life struggles can also get in the way sometimes. There's many ways a nurse can overcome these challenges. Veronica is a great PCT who's always willing to sit there and listen. They're always there to encourage me when I need it, like Ellen, who's very helpful when it comes to uplifting me. And I could always rely on them, just like Dr. Patel, who's very patient with me. A few years ago, my mom got into a bad car accident, and she was in a coma, and I was terrified. But I remember the nurses were so caring, and they were so genuine. And not only were they so good with my mom, but they were good with my whole family. And it really made a huge impact. It put my mind at ease. It made us feel better because they were always explaining things to us. And that made me realize I want to be able to do that for other people. And that's why I became a nurse.
Okay, audio recording, video recording.
And I realized that I want to be able to do that to other people. I want to help with people out, but I also want to make them feel better. I want to, I don't know. I just spaced out.
No, that was good, that was good.
I just spaced out and I'm like, I don't know.
So when Melissa was having a very stressful patient, I wanted to make sure that I was... Oh, God.
Damn, that's so close!
See what I mean? Like,
okay, repeat.
Okay.
Oh, hold on.
I wanted to make sure Melissa...
Hey Dave, what just happened right now?
Basically I just spilled on myself. It's pretty awesome. I feel like a movie star though, not gonna lie.
This is Veronica's commentary. Alright, Veronica's commentary. Whenever you're ready. Hold on. Okay, whenever you're ready. Film rolling.
Yeah, I was really
Hold on. Film rolling. I need to record audio first. Okay. Audio recording. Okay, go ahead.
And I'm going to support groups now, so it's been a lot better for me right now. I messed up.
Alright, go ahead.
One more time.
Pharmacy and get it.
But what you gave me didn't work.
All right.
I want more of this.
No, we have to take your IV out.
Why?
Sir, let me take your IV out.
No, but like this was kind of working. I need more.
Okay, I need to take your IV
Can I have more?
You will get medication.
But my back
now.
hurts.
You cannot go
You're
home
such a
with
bad
an
nurse.
IV.
I want another nurse.
You know what? I'll get your doctor.
Alright, ready? Scene 6, right? Scene 6? Alright, scene 6. Action.
Here they come.
Hello. I have a 17-year-old female. Found at home unresponsive. Possible heroin overdose. Why are you not lying?
Who's there?